Hey everybody, welcome back to my channel where we're talking about menopausal hormone therapy. And today we're going to explore the research on whether or not estrogen affects the brain. I'm interrupting this content to request that if y'all enjoy learning with me, give me a thumbs up and share. Subscribe to this channel. It helps me reach a broader audience to help improve health literacy for all. I'm here to make the medicine make sense. This is one of the most debated, emotional, and misunderstood topics. So around 5% of US women over age 60 have dementia. This rises to 12% after 75 and 28% after the age of 85. With women living longer than ever, preventing cognitive decline is of key importance. In a previous video, I discussed the Lancet Commission's updated report. This was published back in July of 2024, and they highlighted 14 modifiable risk factors that we can work on. In this video, I'm going to review the menopausal hormone estrogen research to see what the prospective randomized trials show. Now, what have women reported? During perimenopause and early postmenopause, many women have noticed symptoms: forgetfulness, difficulty with finding words, difficulty multitasking, and then an overall sort of vague brain fog. Because these symptoms are a change from their usual, there is alarm, rightfully so. And a lot of these women are either caregivers or are noticing a parent who's dealing with cognitive dysfunction and Alzheimer's. So there is a concern that this could be the beginning of a long path to full-blown dementia. But to understand the answer, we have to understand how estrogen actually works inside the brain. Estrogen strengthens the cholinergic system. This is a system that's responsible for increased learning and creating these memory or learning pathways. It's also responsible for the NMDA or glutamate system. Estrogen enhances the glutamate NMDA, which is another neurotransmitter or chemical system that drives long-term potentiation. This is how your brain learns and stores new information. Estrogen increases dendritic spine density and synaptic connections so it can communicate better. Animal studies have found that neurons actually do communicate better in the presence of estrogen. Estrogen lowers oxidative stress and protects neurons from damage. Estrogen is also known to involve itself in mitochondrial function, which helps with energy processing. And then finally, studies have shown that estrogen actually helps improve DNA repair, and animal studies have shown that with estrogen, DNA repair processes are enhanced. So in theory, supplying estrogen should help, no? Endogenous estrogen, which is the estrogen that's normally produced in the body, does appear to play a role. Perimenopausal women will often report memory changes, and in research settings, midlife women with higher estradiol levels actually perform better on detailed memory tasks. However, the advantage disappeared after menopause when estradiol levels fell. Observational studies found that postmenopausal women on estrogen therapy have been actually with conflicting results. Some women showed a slight cognitive benefit. Others showed no effect. And some suggested harm, especially in those with the genetic mutation or gene ApoE4. The largest study, the Nurses' Health Initiative, found no relationship between estrogen use and memory on 6 different cognitive tests. And women with ApoE4 actually had worse cognitive decline when on estrogen therapy. So observational studies can be helpful, but they have limitations. That's why we need those large randomized studies. The Women's Health Initiative Memory Study, also known as WHIMS, which is the strongest evidence we have, looked at women over age 65 who had no dementia when they started hormone therapy. And they had some very clear findings. Combined estrogen and progestin therapy offered no cognitive benefit. There was no improvement noted on those subjects and their global cognitive testing. More women on menopausal hormone therapy had clinically significant cognitive decline. We're talking about 6.7% of those in the combined estrogen progestin therapy treatment, and then 4.8% of those who were on placebo. And then finally, estrogen alone also did not help. Women on estrogen alone were more likely to have significant drops in their MMSE scores. That's a mini mental status exam. That's a score that we often use to diagnose someone with Alzheimer's or dementia. These studies suggested that starting menopausal hormone therapy after age 65 did not protect cognition and may actually accelerate decline. So then let's talk about this critical window hypothesis. This is the idea that early postmenopausal exposure actually preserves brain function later. We talked about this effect before when it came to providing estrogen to women that were between the 50 and 59-year-old category within 10 years of menopause. And there are some small suggestive data sets of protection with early initiation, but high quality data did not pan out. We've got the ELITE trial, which showed early versus late estradiol. There was no cognitive benefit in either of the groups. Then there's KEEPS, which was given to women aged 45 to 54. They gave hormones to women in the age group of 45 to 54, and there was no improvement in cognition. And then the WHIMS, which is the Women Health Initiative participants aged 50 to 55. They had no long-term cognitive benefit either. Early observational studies suggested a 30 to 40% reduced risk of developing Alzheimer's in patients who were on hormone therapy, but those studies were small, they were inconsistent, and they were subject to many limitations. More recent meta-analysis studies show no significant protective benefit. The WHIMS dementia data, basically the Women's Health Memory Study, found that estrogen plus progestin actually doubled dementia risk. Estrogen alone increased dementia risk, although not statistically significant findings. And then pooling the data showed a clear increase in dementia, both in groups that were given estrogen and groups that weren't. But most striking of all was they found that there was 23 additional dementia cases per 10,000 women per year. So starting hormones after 65 actually increased dementia risk. Why does this evidence conflict with the theories and earlier evidence showing that estrogen had a benefit? So this is really important for people to understand, is that in theory, in vitro biology studies don't necessarily correlate with real life patient outcomes. Estrogen also has vascular effects that can increase inflammation. There was the triglyceride component. And then study populations were actually different. You're looking at younger versus older women. You're looking at a natural sort of study versus surgical menopause patients. And then they're also comparing different uses or formulations of estrogen. Dementia may arguably be developing over decades, making long-term studies a bit challenging. And there was no major clinical trial that showed menopausal hormone therapy prevented dementia. Can estrogen prevent Alzheimer's, though? The largest study included 120 women on estrogen for 1 year. These women already had Alzheimer's. And the results show that there was no significant change in cognitive function for 1 year, no improvement in daily activities, and there was no benefit to the mood. A meta-analysis of 7 additional trials confirms the same, that estrogen does not treat Alzheimer's disease in any meaningful fashion. What does the literature or the research say about neuroimaging findings? We're talking about CTs and MRIs. And they found that the KEEPS trial found fewer amyloid deposits with transdermal estradiol in genetic carriers of the ApoE4 gene. This doesn't necessarily mean that this prevents Alzheimer's, but amyloid has been associated with Alzheimer's development. So what do the guidelines tell us as physicians? Societies are clear when it comes to their mandates. For women over age 65, we do not use menopausal hormone therapy to prevent cognitive decline or dementia. For women in early postmenopause, the evidence does not support using menopausal hormone therapy to preserve cognition. And then for women with Alzheimer's disease, estrogen is not recommended as treatment. So menopausal hormone therapy does appear to have a clear role in treating menopausal symptoms, but the symptoms that menopausal hormone therapy really target are your vasomotor symptoms, like the night sweats, the hot flashes, the irritability, the disturbance in sleep. Anything in addition to that doesn't seem to have much of a benefit, at least in these studies. If you're experiencing any of these symptoms, it's very important to bring these to the attention of your physician, where you both are involved in shared decision making. Your physician is going to take into account your past medical history, family history, risk factors for developing cancer and other diseases, your concurrent medical conditions like triglyceride levels, diabetes, metabolic syndrome, and come to a conclusion for their best advice. And ultimately, you two together are more likely to create an informed opinion. Don't forget to like it, share, and subscribe. Until next time.